Welcome to Master USML. Today's case is about a diabetic patient in septic shock, a high-yield, real-world emergency that requires fast, life-saving decisions. Let's break it down step by step. A 68-year-old man with diabetes and kidney disease comes to the ER. His family says he's been confused, weak, and not eating for 2 days. They mention he had a blister on his foot last week, but he ignored it. What we see in the ER: he looks sick, pale, weak, barely responding. His foot: a large blister, red skin, and a strong odor. Vitals: temp 38.2 degrees Celsius or 100.8 degrees Fahrenheit. BP 88/52. Pulse 115. Breathing fast at 22 breaths per minute. Oxygen at 98% on room air. What's happening? This patient has sepsis from a diabetic foot infection. The low blood pressure and confusion tell us that his organs aren't getting enough blood. This is a medical emergency. The first 3 things that must be done. First, IV fluids, immediately. The heart isn't pumping enough blood. Give 30 ml per kilogram of IV fluid as fast as possible. Check BP, urine output, and lactate. Second, IV antibiotics, no delays. Diabetic foot infections are serious. Start broad-spectrum IV antibiotics immediately. Vancomycin for MRSA, piperacillin, tazobactam or meropenem for gram-negative, and anaerobes. Take blood cultures, but don't wait for results. Third, source control. How deep is the infection? Bad smell with a fluid-filled blister? Think deep tissue infection. Could this be necrotizing fasciitis? If tissue is breaking down fast, call surgery now. Get an X-ray or MRI if needed. What about blood sugar? Yes, glucose is 280, but that's not the emergency here. First, fix the sepsis. Insulin comes later, after fluids and antibiotics. Starting insulin too early can drop blood pressure even more and make things worse. When to start vasopressors? If fluids don't fix the BP, start norepinephrine. Dopamine is outdated. Don't use it. If the heart is weak, add dobutamine. Key takeaways for USMLE. Step 2. EK diabetics can have deep infections with no obvious signs. Always suspect sepsis. Fluids first, then antibiotics. No delays. If BP stays low, start norepinephrine. Glucose is not the priority here. Fix the infection first. Think about necrotizing fasciitis if the foot wound looks severe. Final thoughts. Sepsis in a diabetic patient is a must-know case for USMLE Step 2. Okay, if this helped, subscribe to Master USMLE. Next episode, how to tell cellulitis from necrotizing fasciitis and avoid deadly mistakes. Keep studying smart and stay ahead.